The November 24th, 2020 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Colby.
Present.
Mr. Colby is present. Mrs. DeFlorio.
Here.
Mrs. DeFlorio is present. Ms. Hassman.
Here.
Ms. Hassman is present. Mr. Hebert.
Here.
Mr. Hebert is present. Ms. Lamar.
Here.
Ms. Lamar is present. Mr. Lee.
Here.
Mr. Lee is present. Chairwoman Smith.
Here.
Chairwoman Smith is present. Mr. Wilt.
Here.
Mr. Wilt is present. Mr. Udelson.
Here.
Mr. Udelson is present.
We will need to suspend the rules of the legislature for the purpose of prohibiting public in-person attendance in accordance with Executive Order 202.1, which was extended through December 3rd by Executive Order 202.72. You have a non-debatable motion on your agenda, which needs a maker and a second.
So move, Madam Chairman. Second.
Moved by Legislator Hebert, seconded by Legislator Colby. All those in favor, please signify by saying aye.
Aye.
Aye. Aye.
Any opposed? Any opposed? Item carries. Is there anyone signed up for public forum?
There's no one signed up for the public forum, nor were any written comments submitted in advance of the meeting.
This concludes the public forum. I'd like to introduce Robert Franklin, Chief Financial Officer of Monroe County, who is here to present the 2021 proposed Monroe County budget as it pertains to the Human Services Committee. We will have a question and answer period following the presentation. Mr. Franklin?
Thank you, Madam Chair. I'm going to start sharing my screen. This is the 2021 budget presentation as it pertains to the Human Services Committee. It's probably not quite as brief as maybe some of the other committees, but I will try to plow through as expeditiously as possible. Budgeted spending for our health and human services areas accounts for about 56% of Monroe County's budgeted spending. The departments and areas within the purview of this committee include our Department of Human Services, which really is social services, our mental health office, our office for the aging, and our Rochester Monroe County Youth Bureau. It also includes the Department of Public Health, our Monroe Community Hospital, and our Veteran Services Agency. Right off the bat, if you're looking at this screen, I'd like to say please don't get too worried about the appropriation reduction you see for public health. They bring forward a lot of grant acceptance referrals during the year, and 2020 will be no different. I will also point out that 2020 amended budget included a one-time appropriation, a fund balance for the payment of debt service, which also inflated their appropriations. Looking at our Department of Human Services first, within the Administration and Operations divisions of DHS, a quick notable highlight is that the department is seeking to create a data team for better decision-making and analysis around its resource allocations, its contract monitoring, and its program performance monitoring. And a couple notable highlights within the public assistance benefits line you see on the screen. The 2020 amended budget includes $2 million from an enhanced child care grant that will not be re-awarded in 21. It also includes our statutory payment for Medicaid. We generally call it the Medicaid cap payment. That is going to be actually lower for 21, lower by about $6 million. And I'll note that reduction more than offsets the increases you'll probably see later in this budget in our family assistance benefits and our safety net assistance benefits. I also want to point out there are significant reductions in the adolescent care section of the budget, and that really is due to the recent PINS reform and reductions in child welfare due to more realistic estimates of the costs associated with the recently passed Raise the Age legislation. Our mental health services are modestly increasing, and that's mainly associated with the increase in the number and cost of court-ordered psychiatric evaluations. And then appropriations within the Office for the Aging are lower than what you see in the 2020 amended budget, and that's really due to the receipt of CARES Act funding in the current year. But the appropriations are increasing compared to the adopted budget on this screen, and that actually reflects additional funding of provider contracts. And finally, our Youth Bureau, their appropriations are slightly lower, and that is a result of the recent change in administration and staff turnover. Generally, the new staff coming in tend to be paid at a lower rate of pay than their predecessors, lowering the overall cost of salaries and benefits. Looking at our Department of Public Health, there's a lot on this page. I'm just going to hit a couple notable highlights. The amended budget for 2020 includes about $4.4 million in grants that they've accepted during the year. Many of those grants, or others, will come before this legislature again throughout 2021. The amended budget for 2020 also includes, as I previously noted, $3 million for the full redemption of a bond anticipation note related to the Ames Building reconstruction and addition for the medical examiner's office, and there is no such appropriations for a redemption in the coming proposed budget. New for the proposed budget is the Opioid and Addiction Services Task Force. It's also known as the Improving Addiction Coordination Team, or just IMPACT. This is a new 8-person team to combat the ongoing substance abuse disorder crisis within Monroe County. They will coordinate addiction services and care to bring a more comprehensive, multifaceted program to the community. And while located within the Public Health Department, I will note that it is entirely funded by the county's Office of Mental Health. The 21 proposed budget also provides additional support for our early intervention program, with the addition of 3 new program positions. I think many in the committee know that over the past 2 years, the department has utilized its own existing clerical staff from other functional areas to help the early intervention team perform many of their clerical tasks, and they will continue to do so in 21. But we are also adding 3 new assistant and senior assistant health services coordinators. Recruiting and retaining qualified staff isn't easy, so this proposed budget also addresses that by raising the pay for those on the entire service coordination team. Those new costs are partially offset by the state's Early Intervention Administration grant, so it will not be 100% borne by the county. Lastly, I think the committee has heard recently that the payment rates for preschool special education related services will increase by 5%, and it will be effective with contract renewals taking place on July 1st. We usually talk about speech, physical therapy, occupational therapy, but related services also includes others such as teachers of the hearing or visually impaired, music therapy, audiology, counseling, and several other services. Looking at Monroe Community Hospital, this slide is kind of opposite of what I generally show. Instead of trying to detail out the various appropriations, I thought it might be beneficial to the committee to show you how MCH funds its appropriations. First is the CARES Act funding that the county received in 2020. The $1.4 million specifically allocated for Monroe Community Hospital reflects the resolution adopted earlier this year, I believe it was April or May, for which we accepted funding and also appropriated the revenue. So acceptance of that funding increased both the hospital's revenue and its appropriations. And of course, that CARES Act is not anticipated in this budget to continue next year, so you will not find it in either place, appropriations or revenues. The second line on revenues is patient billings. I'm sure many of you know that MCH is predominantly Medicaid funded, but there is also Medicare billings, long-term care insurance billings, and certainly private pay billings as well. This revenue is predominantly dependent on the hospital's bed census, the severity of each patient's diagnosis, and the associated billing rates for the services that are actually delivered. Next, a somewhat volatile revenue source is from the Medicaid upper payment limit. It was formerly called Intergovernmental Transfer Program. Now, New York State negotiates with the Federal Center for Medicare and Medicaid Studies on how much the federal government will support non-state-run hospitals with high Medicaid populations. Once that's negotiated and settled, our specific allocation will be funded 50% by the federal government and 50% by us. We will send $1 to New York State DOH. The federal government will match that dollar, and then New York State DOH will turn around and send $2 to Monroe Community Hospital. Lastly, our hospital generates other revenues, and they come from tenants renting space within the hospital. That would include the U of R, the Alzheimer's Association, our own Department of Human Services, among a few others, and their food, their cafeteria operations. And at the very end, you'll note on this screen, the general fund provides a subsidy also to Monroe Community Hospital, and that subsidy is being presented to you as an increase to $3.5 million in this proposed budget. This was included before the latest wave of COVID hit because we really need to address the hospital's continuing net deficit position. However, with the recent increase in COVID activity and the amount of testing that is now required of our residents and our staff, I would suggest that this subsidy increase is even more critical to the hospital's operations. And certainly last, but certainly not least, our Veterans Services Agency, their appropriations are growing very modestly by $42,800. Quite frankly, for the important work they do, and not just applying for veterans benefits that they may be entitled to, but actually help vets returning back to civilian life, I think their appropriation growth is easily absorbed within the county's $1.2 billion budget. With that, Madam Chair, that concludes the presentation. I will stop sharing the screen, and we can entertain questions from the floor.
Thank you, Mr. Franklin. I do want to take this time now to thank all the Human Services departments for their work in 2020 and their compassionate and collaborative care of our residents during the COVID-19 crisis. We are grateful for each of you and for rising to the challenge in those unprecedented times. I will now open the floor to any committee members who have questions regarding the Human Services portion of the budget.
Legislator Hebert.
You have the floor, Legislator Hebert.
Thank you, Madam Chair. First of all, I'd like to add to your I really applaud Human Services coming up with the idea of applying data to make decisions. Data-driven decisions are clearly much better than seat of the pants decisions, and I want to compliment the administration for coming up with that idea. I do have a number of questions, and partway through I'll turn it over to somebody else and pick it up later. Let's go at the beginning. Through the chair, what percentage of the Human Services budget is mandated versus non-mandated? And I suspect it's the same answer as we've gotten early. You'll get back to us, correct?
Oops. Oh, shoot, what did I do? Actually, Madam Chair, if the question is about the Department of Human Services, I do know that answer. It's 99.9%. Nonetheless, Madam Chair, I will respond with the full list of all departments before the December meeting.
Thank you, sir. Through you, Madam Chair, How much, if any, general fund balance is being applied to the human services budget? And can you break it down into restricted versus unrestricted?
Madam Chair, in the 21 proposed budget, there is no general appropriation of fund balance. We are appropriating $270,000, 333 of our reserve for bonded debt, and that is associated with detention center capital projects.
Thank you. Through you, Madam Chair, where can the revenues and expenditures related to indigent burials be found in the 2021 budget?
Madam Chair, you will not see specifically revenues from indigent burials. I'm getting to the page. They are included, and perhaps the page number is not important. They are included in the state aid received for the Safety Net Assistance Program and the Family Assistance Program. Basically, Madam Chair, indigent burials is really not an independent program. It is really a payment type allowable under Family Assistance and Safety Net Assistance.
Thank you. Through you, Madam Chair of the Administration, if you could eventually provide that page number, be great. It's not critical now or even before the Ways and Means or the full committee.
Certainly, Madam Chair.
Through you, Madam Chair, neither the Children's Detention Center nor the Faith-Based Initiatives Office have provided any listing of major accomplishments for 2020 or any goals and major objectives for 2021. Is there a reason for that?
Madam Chair, we tend to, for the most part, leave it up to each individual department to decide upon which objectives, accomplishments are going to be highlighted. I am well aware that a number of functional units are not represented throughout this budget book, and from my experience, managers of functional units like to be represented. In this role, it's a big budget book, and we encourage departments to be judicious in what they want to write about.
Understood. Is there any, through you, Madam Chair, to the Administration, is there anyone else on the line that could give some indication of what their goals and objectives might be and accomplishments? The silence is deafening, so I will move on.
Madam Chair, I will follow up with the Department of Human Services on that specific inquiry.
Thank you, sir. Through you, Madam Chair, on page 163, I'll give you a minute to get there.
I am there, Madam Chair.
Okay, how is state aid going down only about $6 million? It's been my understanding the state's threatening cuts of 20%. They're already holding 20% of payments. So I'm just wondering why it's only $6 million.
Yes, Madam Chair, this particular budget does try to account for the 20% withholding of state aid. Throughout this budget, we're hedging our bets. We're anticipating the 20% withhold of state aid through the end of the state's fiscal year, March 31st. I should also note for you, Madam Chair, and the committee, that not all reimbursable expenditure payments within the Department of Human Services are subject to the state's 20% withhold. Generally speaking, payments for assistance benefits are not subject to that withhold. There are also a couple areas that I'm sure we will get into where we're actually seeing small increases in state aid because of increased budgeted services delivery.
Thank you. Through you, Madam Chair, just if you could expound a little bit, the reasons that you are are hopeful that come 2021 state budget, or whatever the one that starts April 1st is, why you don't think that 20% state aid reduction will continue into that budget?
Madam Chair, it is quite common in the financial world to hedge. Frankly speaking, in this budget process, what a dramatic difference it would be to budget a full calendar's year worth of state aid withholding. Monroe County, if you look, just across the county, it's approximately $200 million in state aid that the county receives. $40 million of 20% withholding. I know we're a $1.2 billion budget, Madam Chair, but if you think this county can absorb a $40 million hit in state aid, I challenge you to find a better way. I think assuming a withhold through the state's fiscal year is appropriate because of changing conditions. And what do I mean by that? Specifically, changing COVID conditions. When the budget was really put together, and a lot of work gets done in August and even September, and then at the end of September, it's just polished, right? This was before the recent uptick in COVID cases in our community. And, things were looking okay. Everyone was concerned that there may be a second wave coming, but concern does not always equate to probability. Of course, what we are seeing today is that uptick. And what I'm going to say now is if this increase in COVID cases continues into the winter and into 21, I no doubt believe this county will need resources to put towards coronavirus mitigation and response actions. And if you pull $40 million in appropriations out of this budget, this county will be dead in the water and will fail in its ability to address the increase in COVID cases. So these appropriations will help you both in good times and bad. So that is why I hedged, Madam Chair.
Understood. And I thoroughly hope you are correct, and certainly things are changing on a daily basis through you, Madam Chair of the Administration. Also on page 163, could you please address why Medicaid payments are going down $6 million? I think you did that as part of your original, but I'm not sure I tied it to this item mentally until just now.
Yes, Madam Chair. Medicaid payments are being reduced from roughly $172.8 million down to $166.7 million. This really reflects the statutory Medicaid cap payment that Monroe County has to make. With the enhanced federal Medicaid assistance program sharing, it's basically over a short period of time, the federal government has increased its participation in reimbursement of Medicaid expenses. That increase in federal sharing must be passed down to the counties because we also pay the bill. Therefore, our statutory cap is coming down by $6 million.
Thank you. Again, on page 163, it appears to me that number of employees in the department is increasing by 8, and that's probably the 8 members of the impact team when all is said and done. Why are we...
Actually, Madam Chair, the additional positions are more related to the data team within Human Services.
Okay. Through you, Madam Chair of the Administration, why with the number of people going up, are we expecting employee benefits to go down $150,000?
Madam Chair, the reduction in employee benefits decreasing for this department, because this is a rather large department, rather large decreases both in in medical and dental expenses.
Okay. I have, through you, Madam Chair, to the administration, Mr. Franklin, when you made your presentation, I believe you were talking about PINs, and you said that allocation was going down because it was a more realistic number applied to it, and I wasn't sure what that number was. Number of youth, number of.
Oh, certainly, Madam Chair. I'm just going to pull that page up on my presentation. Significant reductions in adolescent care due to PINS reform and reductions in child welfare due to more realistic estimates of the costs associated with Raise the Age. I believe, Madam Chair, the legislator is focusing in on Raise the Age. Is that accurate?
That is true.
Madam Chair, with respect to Raise the Age, it is rather new. A year and a half ago, after passage of the legislation, New York State Office of Children and Family Services was presenting to the county some pretty amazing projections in the number of youth to be served due to the Raise the Age legislation. Projections of, if my memory serves me correctly, upwards of 45 additional youth in our detention center. So a lot of money was put towards our Raise the Age plan within detention, also within the child welfare services teams. And what we are seeing over the past year is those projections were a little high. Initially, they were a lot high. The numbers have come up a little bit. But as time has progressed and we are seeing, you know, can I call it the real impacts of Raise the Age, it's not having quite the sharp increase as we expected. So we're basically trying to right-size the budget for 21.
Understood. Thank you, Mr. Franklin. Excellent answer. As normal, I would say. Through you, Madam Chair, can you please provide a breakdown of the cellular telephone appropriations again, as we've done with other committees?
Yes, Madam Chair, it's going to be a lot, but just be prepared.
Understood. Through you, Madam Chair, could you also, no, I'm going to skip that question. Madam Chair, I return the floor to you for the time being.
Legislator Will.
Yes, Legislator Wilk, you have the floor.
Thank you, Madam Chair. Through the chair, on page 487 of Human Services, Central Administration, 501,000 salaries. Does the increase on this line represent new positions, raises for existing positions, or both?
Madam Chair, this particular line does include the normal annually recurring pay and step increases associated with the collective bargaining agreements. This line also does include the 8 new positions previously mentioned.
Okay, thank you. I relinquish the floor.
Legislator Hebert, Madam Chair.
Yes, Legislator Hubert, you have the floor.
Thank you. Through you to the administration on page 489. Let me know when you're there.
Yes, Madam Chair.
504320. Could you please give a little bit of information on what new or expanded services are being utilized?
Yes, Madam Chair. Just need one moment. Madam Chair, this is the line for professional services within our Child and Family Services Division. It's about roughly almost $1.69 million. These would be more administrative type contracts. They include such contracts as our caseworker recruitment program. It would include recruitment for a family type adult group home It includes our contract with Bonadeo as our consultant that provides oversight over division operations. This area would also include the contract we have for our Child and Family Services resource team, leadership coaching and development. This also includes, I mentioned caseworker recruitment campaign. We have a similar foster parent recruitment campaign. It also includes contracts for training. There are a number of training contracts for not just programmatic training, but staff leadership development. Shall I go on, Madam Chair, or does this give you an adequate flavor of the types of administrative contracts?
I'm fine with that answer.
Thank you.
I can return the floor to you, Madam Chair.
Legislator Udelson.
Legislator Udelson, you have the floor.
Thank you, Madam Chairman. Before my questions, I just want to echo the chair's praise of the human services workers. It was well said. And also echo the comments of Legislator Ebert praising the decision to go to data-driven decisions as compared to the previous way of doing things. I think that also, I also think that will be a great improvement. So my first question through the chair, there's been a great deal of conversation about the need for the services of the FIT teams so that they can help manage difficult situations, sometimes involving people with mental health problems. Compared to the original 2020 budget set by the previous administration, how have resources been increased in this area for 2021, and how will they be deployed?
Madam Chair, I do know that our Office of Mental Health received recently a grant award of several $100,000 for expansion of the FIT team. Regrettably, that's the extent of my details. I do see Deputy Commissioner Ann Ickes on the line. I'm not sure if someone from our Office of Mental Health is available to answer this question. Kelly is. May I defer, please, to the Office of Mental Health?
Yes, hi. This is Kelly Wilmot with the Office of Mental Health. Through the chairwoman, we did receive a grant that will actually be presented to the legislature for acceptance next month, I believe. It is a grant that is a 3-year grant, and it will allow us to add 2 additional members to the FIT team. Those will be full-time positions, and the intention is to allow that program to expand on its current operating hours to move closer to a 24/7 model of operation.
Okay. Thank you, Kelly. Through the chair, on the issue of subsidies for daycare, during the past year that subsidy rate was changed to decrease the parent's share, as I understand it. What's the planned rate for 2021? And how does that compare to the minimum amount that parents can be required to pay?
Madam Chair, under state regulation, the parent fee or the parent share ranges from a minimum of 10% to a maximum of 35%. It is the intention in this budget proposal to have the parent fee at 10%, which is the minimum allowed by regulation. I believe earlier this year it was lowered to 20%. Prior to that, it was 25%. It had been 35% before that.
Okay, thank you very much. And one more question through you, Madam Chair. The COVID situation, it's been mentioned tonight, and it's certainly taken some of the media attention off of the opioid addiction problems that were so much in the news before, but we know that they continue. How does the 2021 budget provide resources to continue to address that problem?
Madam Chair, with the 21 proposed budget, we do have included 8 an 8-member addiction services task force team, Impact, as they're also known. You don't see their appropriations specifically in the budget book. I would have to draw your attention to page 519 of the Department of Public Health, their Administration and Special Services Division. That is a functional team within this particular division, and their salaries and benefits are incorporated here.
Thank you, Mr. Franklin. Thank you, Madam Chair.
Madam Chair, Legislator Colby.
Legislator Colby, you have the floor.
Thank you, Madam Chair. I'd like to take us to page 172. We are expecting a decline in Medicaid applications of 1,000 people or 1,000 applications, yet the average number of monthly Medicaid caseload increases by 3,000. I don't know if I'm understanding the math here right, or I'm not comparing apples and apples. Could you highlight or increase my knowledge?
Madam Chair, I do believe we have someone knowledgeable from Department of Human Services, perhaps Director Denise Reed.
Good evening. This is Denise Reed. I am the Director of Financial Assistance through the chair. So in 2020, the state has automated Medicaid recertifications. And so we have seen fewer and fewer case closings. So even though applications are not expected to rise, we don't expect to see the subsequent decline in caseload size if the state continues to automate the recertifications. So people are getting recertified for Medicaid who normally might have been closed because they move, maybe they don't even live in New York State anymore, but the state's doing automated recertifications through the end of the year, and it probably will continue for the early part of 2021.
So follow up on that. So if somebody moves out of the state, we're still sending them payments because the state doesn't remove them?
They might not be using Medicaid services, but the state is just blanketly recertifying all Medicaid cases at this time. They have been through the pandemic. So we are not making any eligibility determinations on them. I mean, we normally have an attrition rate for Medicaid. You know, people don't recertify, they fall off. That hasn't happened this year, and we don't expect it to continue if the state continues to recertify those cases. So it does not necessarily mean that that person moved out of state and is still using the New York State Medicaid. It's just that the state is not doing any evaluation of eligibility. They're doing an automatic renewal of the cases.
So to follow up on that, could they move out of state and still be getting New York State Medicaid payments?
Through the chair, it's not likely. I mean, that provider would have to be signed up to receive New York State Medicaid, and that usually doesn't happen across state lines.
On page 491 of the Human Service Financial Assistant, line 501000 salaries, do the increase in this line represent new position, raises of existing position, or a little bit of both?
I'm sorry, Madam Chair, is that page reference 491?
Yes.
Thank you. Madam Chair, the salaries on this page, the budget is increasing from 2020. It is really mostly due to the normal pay and step increases associated with the collective bargaining agreements.
Thank you. Through you, Madam Chair, on the same page, 504205, commercial services. What new or expansions of commercial services are being utilized?
Madam Chair, within the Financial Assistance Division, their commercial services are predominantly comprised of interpreting services. That's about $240,000. Temporary nursing for their home care unit. That's about $302,000. They have a Welfare to Work Case Management System Data Entry Team through NICID. That's about $125,000. They also incur $53,000 of document shredding. And this particular appropriation does have a placeholder for $114,000 for replacement carpeting.
Through you, Madam Chair, speaking of that, this division is all in the, on Westfield Road, is that correct?
That is one of their locations, Madam Chair. Their other offices are at 691 St. Paul Street.
So you mentioned the carpeting. Is there any other improvements that have been done to these two locations? And is there any in the budget for this coming year?
There are, Madam Chair, a lot of the repairs and maintenance that were originally budgeted for 2020 have been unable to be fulfilled, and those requests are being repeated for 2021. To be frank, I keep my eye on those types of appropriations because if this COVID pandemic were to flare up even more than it is, you know, this is part of the game plan the county put in practice in 2020 to hold spending in order to have appropriations available for necessary COVID mitigation activities. This may be a line I will keep my eye on for potential budget reserves.
Thank you. I'll yield the floor back to you, Madam Chair.
Legislator Lee.
Legislator Lee, you have the floor.
Okay, Madam Chair, through the chair, on page 161, under the County Youth to Work program, what types of opportunities will be created for the youth to gain meaningful employment?
If I may, Madam Chair, Denise Reed, Director Denise Reed is still on the line.
Denise is on the line, but I'm going to defer to the Youth Bureau Director.
Oh, the Youth Bureau Director.
I'm not sure if Brent is on the line, but that is not the Welfare to Work, the Youth Work program is not under my purview.
Thank you.
Okay.
Madam Chair, with the silent, I'm going to make the assumption Director Whitfield is not on the line, so we would like the opportunity to follow up later, please.
Could you do that for me, please?
Absolutely, Madam Chair.
Legislator Lee, do you have any further questions?
Yes, Madam Chair, through the chair, on page 162, how will you address the communities of color specifically regarding mental health disorder, behavior, and/or substance disorder? And what types of outreach would you be looking like?
Madam Chair, I believe this is pertaining to our Office of Mental Health. If Ms. Wilmot is still on the line.
Yes, I am still here. May I ask to have that question repeated, please?
Okay, yes. How would you address communities of color specifically regarding mental health disorder, behavior, and substance or disorders? And what type of outreach would it look like?
Thank you. Through the chairwoman, we're approaching this in multiple ways at this point. We have been actively looking at the data that currently exists to look at the breakdown of the people who are currently being served by the system. We are also engaging in some behavioral health task force work, which is very intentional around looking at how we can best serve our underserved populations. And so we have a lot of different representation at those tables, including community voice and people from our provider systems. And we're doing some very specific work around trying to identify the barriers that are keeping people from pursuing care, breaking down stigma and really taking a look at, what we recognize as a lack of trust in the system. Our office is also participating in the RAISE Commission work related to the mental health and addiction subcommittee work. And so that is also creating opportunities to really hear community voice around what would be most helpful.
Okay, thank you.
You're welcome.
Legislator Hasman?
Legislator Hasman, you have the floor.
Yes, thank you, Madam Chairwoman. On page 284, there's an increase in early intervention services. And as I was delighted to see that, and I was hoping the administration could provide some more detail on what the county will be able to provide, especially near and dear to my heart as the mother of a child who's received early intervention, speech and occupational therapy.
Thank you, Madam Chair. Yes, our special children's services within the Department of Public Health, I believe I mentioned in my presentation, over the past couple of years, they've brought in clerical staff from other functional units to help with that team's clerical needs. And while they will continue to do so, we have the opportunity now to add 3 positions within the Health Service Coordinator title series. So that will be 3 additional staff assigned to the Health Services team for coordination duties, whatever public health needs to do from a programmatic management perspective. It's interesting that what we are seeing in this COVID pandemic is because so many of our schools have gone to online learning, actually a decrease in the utilization of early intervention and preschool special education services. This actually provides now an opportunity with this slight downturn, bringing on the additional staff to streamline this operation and provide more timely, effective, and efficient services and get them scheduled out to the community providers. We are also, in this budget, proposing to increase the payment rates of our providers of related services by 5%. And that will be effective with the contract starting July 1st. There are a whole host of related services. I think I've mentioned several. Obviously, the 3 biggest, speech, OT, and PT, but assistive technology, audiology, teachers of the hearing impaired or visually impaired. There are actually a whole host of others. I'm more the budget guy. I just know a little bit about the program to be dangerous. If the public health staff is on the line, they may want to tag team and jump in.
Hello, this is Frank Galisano with the Department of Public Health. Just to add on to Bob's comments, there's 2 things in addition that we're investing in this year. Additional training in our McGinnis software for our staff, which will allow us to utilize additional data and also better billing systems. And the other big point is our investment in point of contact care involving our transportation, which is going to, a company that's going to help us better utilize transportation for services.
Okay, that's all I have. Thank you. Just seems like COVID seems to suck all the oxygen out of the room, and there's so much other important services that are being provided. So thank you for that thorough answer.
No, you're welcome.
Mr. Franklin, on page 493 of the Human Services Operations under salaries, does the increase on this line represent new position raises for existing positions or both?
Madam Chair, on this particular page, the salary increase represents the routine contractual pay and step increases.
Thank you. On page 495, could you let us know what is the driving reduction in the Office for the Aging of 1.5 million?
I'm sorry, page 495?
Yes. This is under the Human Services Administration Purchase Services, Staff Development.
Oh, staff development.
Yes, sorry.
I'm sorry.
I know I switched gears there on you.
Oh, that's okay. If I may, Madam Chair, ask for the specific account again?
This is the reduction of the Office of Aging, so it's 1.5. I don't have the actual account. I think it was overall.
Madam Chair, I think we may need to follow up with this question in writing. I'm looking at page 495. It's Human Services Staff Development. I'm not seeing a $1.5 million reduction nor a reference to aging.
Okay, let me go back and look to see my notes. I'll get back to you on that.
Very good. Thank you, Madam Chair.
No, thank you. Yes. Any other legislators have some questions?
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, the 2020, there was a major objective listed for 2020 with the Children's Center for design and further expansion. And my question was, what is the status of the design and expansion, if the major objective has been worked upon? And I know that you had mentioned that was decreasing expectations in the population at the detention center. So I'm wondering if there have been changes to that.
Madam Chair, I'm going to try and give a short answer to this because I know a lot of I tend to ramble. The status of the detention center's reconstruction projects is tenuous in that the state of New York, which is facing its own financial problems, has kind of been pushing us off a bit. We are in the process, and we've had recently two phone conferences with Division of Budget and OCFS and the corrections, SCO, the correction staff, to talk about our construction plans. We work with Environmental Services. We have a revised cost estimate. The April revised cost estimate is $31 million. New York State now has asked us to go ahead and resubmit our Raise the Age plan with the capital project included. We have done that. We had to do it with the prior year plan because the new plan is not effective. And we now received additional word that the 2021 plan will soon be available, and they're asking about debt service, and we need to include all that detail in the new plan. So that became a long-winded answer. My apologies.
I think I'm good. Thank you.
Thank you.
Through the chair, on page 177 under Children's Center also, I notice there's a large increase in secure detention care days. Can you indicate what's driving that?
One moment, Madam Chair.
Certainly.
Yeah, she said she didn't speak because she was.
Madam Chair, I believe we do have our detention director on the line.
Okay. Thank you.
Through the Madam Chair, this is Catherine Thomas, the director at the Monroe County Children's Facility. What's driving that is that the days of care that we're seeing with the Raise the Age is much longer than has been in the past. And also for some of our juvenile offender youth also are lingering longer in the detention facility, which is driving the days of care.
Thank you. Through the chairs, still on the Children's Center, on page 496, the 504205 commercial services. Notice there's a decrease on this line. So you could explain what that decrease is, or what's driving again that decrease?
Yes, Madam Chair. Commercial services, as requested in the 21 proposed budget, is mostly our security services. We work with the company Securitas. Previously, this particular line had included our food service costs. Food service has been pulled out of this line and moved down to professional services, 504320.
That was my next question.
So then, Madam Chair, looking at professional services, professional services would include items like food service, our medical professionals, our mental health professionals, our therapeutic recreational aid, and we also contract with an attorney for specialized legal research.
Thank you. So that line is increasing due to food service being added in, correct? Or,
yes.
I mean, probably. Okay.
And frankly, the 2020 budget was a little high because that included an estimate of population associated with Raise the Age, which really didn't materialize.
Gotcha. So then on that note, is Raise the Age in theory fully implemented at this time?
In theory, yes. Yes, it is, Madam Chair.
Okay. Great. Thank you. And I'm good for now. Thank you.
Thank you.
I've just been informed that the clerk's office is having technical difficulties. They can't hear us, I don't believe. And while they're working that out, I have a question or two to ask. One is moving on to the safety net portion of the budget. Another one, I need some clarification on some numbers. Why is the average caseload expected to rise 437 per month, or roughly 9%? This is on page 180, I believe.
Madam Chair, yes, we are budgeting for an increase in our safety net caseloads. We have seen during this COVID-19 pandemic kind of a remarkable reduction in the number of applications being submitted. We built a budget anticipating trying to disregard the impact of a potential second wave. So we built a budget that would accommodate the appropriations necessary should people start coming back in and reapplying for safety net assistance. And this budget accommodates that.
One further question, it's not quite related to this area, but it kind of follows up on Legislator Lee's point. We're seeing a lot of shutdowns and lockdowns of senior centers and those type programs, and also nursing homes. And I'm quite concerned that one of the key issues of people's health of all ages is their mental health. Is there any increase with this shutdown? I think we're seeing, you're going to see a lot more mental health issues. Is there any place in the human service budget where we have thought ahead of time to put some money aside for some additional mental health resources that will become needed, I believe?
Madam Chair, I believe Ms. Wilmot is probably the best person to step in with a response.
Thank you. This is Kelly Wilmot again with the Office of Mental Health. Through the chairwoman, you're correct in that I think we're not going to know for a while yet what the full impact is on our community in what has, really been a difficult year. We do know that we are seeing more people coming to the psychiatric emergency departments, and we're seeing more people meet the threshold for admission. So we are, as we talk about next year and trying to anticipate what the needs are going to be, there's not necessarily new money to work with, but I think we're approaching it from the perspective of working with our providers to use their funding most efficiently and in a way that's going to address the needs that we are anticipating. We are seeing some increased interest from our clinic providers to be locating mental health satellites within the schools, and that will be an important resource for children and teenagers and really be able to provide a service in a location close to their homes.
Thank you. Madam Chair, are you back on now?
Yes, we are. Legislators and attendees, we did lose audio for a little bit in the chambers. The discussion was still recorded, though. Mr. Franklin? Yep. Okay. Mr. Franklin, going back to my question earlier, I did give you a wrong page number. On page 191, what is the driving reduction in the Office for the Aging of the 1.5 million?
Oh, 1.5 million for agency contracts, Madam Chair. Yes. The 2020 amended budget that you see on this page does include federal CARES Act funding that was directly awarded to our Office for the Aging. And we do not expect that funding to continue into 21. So that really explains why you see that reduction.
Thank you, and thank you for your time with that. Another question, Mr. Franklin, on page 183 under daycare, how many children have been served through the daycare subsidies in 2020?
Madam Chair, through at least September of 2020, the average subsidy payments, the average number of children for whom a subsidy payment was made was 5,163. That is quite low, Madam Chair. This pandemic has resulted in quite the downward trend in actual utilization of daycare services.
Thank you. Through the chair, Mr. Franklin, so on page 183, still under daycare, the past 2 years there's been a reduction to the parent fee for subsidized daycare. Are you planning on making a similar reduction in 2021?
Yes, Madam Chair. Actually, the budget for 2021 anticipates lowering the parent fee to 10%. That is the lowest amount authorized under New York regulations.
Thank you.
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you to the administration, on page 184, Human Services, Adolescent Care. What accounts for the decrease in funding in this division, specifically as the budget is allocated to JD Penn's care?
Thank you, Madam Chair. Yeah, Penn's placements have been greatly reduced. Earlier in 2020, Penn's reform legislation not only ended the use of non-secure detention, it also ended Penn's truancy petitions and acted other hurdles to the use of congregate care placements for Penn's youth. Really, the idea is to keep trouble teams in their home with their family. With those hurdles put in place, the number of Penn's youth being served is coming down quite dramatically. And with that, you're seeing a corresponding reduction in the appropriations.
Thank you. Through you, Madam Chair, to the administration. Same page, same topic. does that explain why, does the PINS reform legislation explain why the non-secure detention goes to 0 in 2021?
It does, Madam Chair. Non-secure detention is no longer an option.
That's what I thought I heard you say. Thank you. Through you, Madam Chair, to the administration, page 186, child welfare. How does foster care end up declining by more than $2.5 million? I'm sorry, I don't have
Madam Chair, included in this particular appropriation line is the staff, the child welfare staff that focus on raise the age children. They're like a previous response. Given the high estimates of raise the age youth that would need services, prior budgets were relatively high. And now that these projections are not panning out as dramatically as anticipated, you're seeing a corresponding reduction in the appropriations.
Thank you. Through you again, Madam Chair. Same page, same topic. Why is state aid down $3.3 million? Is this the same related answer that you just gave?
I'm sorry, was that state aid, Madam Chair?
Yes, state aid. I'm sorry.
Madam Chair, yes. Basically, the state no longer reimburses us for PINS youth, so that funding source has gone away.
Okay. Thank you. I yield the floor.
Legislator Wilt.
Legislator Wilt, you have the floor.
Thank you, Madam Chair. Through the chair, on page 188, purchases of services. Earlier in the budget stated all CPS positions were fully funded, but the total budget goes up less than $300,000. Please explain why.
Madam Chair, on this particular page, this is our purchase of service. This would include, as we note, appropriations by service area. A number of these service areas really don't directly relate to child protective services, like our homemaker and housekeeper, our adult protective services, other Title 20 and domestic violence. So what does relate to child protective services is the second line on this page, and it's for 2021 proposed budget. It's an appropriation of $22,181,226. That is slightly higher than the amended budget for 2020. So when it comes to trying to prevent the imminent placement of youth into foster care, preventive services is the means to do that, along with our own staff. So actually the value of these contracts is increasing slightly, but increasing nonetheless.
Okay, so that's the reason for the $300,000 increase?
Predominantly, Madam Chair, yes.
Okay, thank you. And through the chair, on page 161, the Office of for the Aging list, on the road, job fairs, what are specifically targeted toward older adults as a 2020 major accomplishment? Please describe this program and outline how many participants there were.
Madam Chair, if I believe I see the name Steve Newcomb. He's within our Office for the Aging. If I can defer to him, please.
Yeah, thanks, Bob. This is Steve Newcomb. Madam Chair, could that question be repeated, please?
Yes. The Office for the Aging on page 161 lists on the road job fairs that are specifically targeted toward older adults.
Okay.
As a 2020 major accomplishment. Please describe this program and outline how many participants there were.
I can get those numbers for you. I will say that initiative was part of an overall county initiative for job fairs on the road. When COVID came about, the outreach towards older adult workers decreased dramatically. So we haven't been partaking in that program for the better half of this year.
Okay, could you get those numbers to us,
I will
please?
do that. Yes.
Thank you. I relinquish the floor at this time.
Legislator Lee.
Legislator Lee, you have the floor.
All right, Madam Chair, through the chair, on page 166, in 2020, there was 48K allocated to asset equipment in the upcoming year of 2021. You plan to allocate 60K. What is the reason for this 12K increase?
Thank you, Madam Chair. The amended budget for $48,000 did cover the cost of 2 pooled vehicles. The budget request of $60,000 also covers a request for 2 pooled vehicles.
Okay, thank you there.
Thank you.
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, do we anticipate receiving any funding for the Safe Harbor program next year?
We do, Madam Chair. We don't really have our allocations. They tend to come late, but there's no reason to believe we won't receive one.
Thank you. And through the chair, I'm not sure, I know that it was the youth director was not on the line earlier. Is he on now, or?
I believe Director Whitfield is on the line.
Great, thank you. So through the chair, the Youth Bureau line indicating youth to work programs in 2020 major accomplishments. Can you describe the program a little bit and what those accomplishments were and how many young people participated?
Good afternoon. Good afternoon, everyone. Through the chair, I can get the numbers for you for the program. Due to COVID-19, I don't believe that the numbers were as high as that we would have liked them. Youth were, of course, it was the middle of the pandemic. Schools were closed. Being able to recruit, but essentially the program we are. It's a new program. It was. I do apologize. It's a new program, and we are. One moment. It's a new program, and we're still trying to build the relationships. We are going to be partnering with some new community partners that will be working towards specifically working with our youth from detention, who are going to be transitioning back into the community. We're looking at a program that will be sort of hiring on site. No resume, no job application is needed, and where they will not be doing a background check.
Great. So through the chair then, in terms of accomplishments that were indicated in the budget narrative, essentially the accomplishment was creating the program, or I'm just trying to understand.
I do apologize. Let me just also say that I'm very new to the position.
Yeah, and welcome. We're thrilled to have somebody in that position finally, so thank you.
So I am still learning all the nuts and bolts for all the programs, but the direction that the program will be going into, that is the direction that we're going in, working a lot with youth who are in detention.
Wonderful, and very much needed. So thank you for that. And that's the end of my questions, at least right now. Thank you.
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you, to the administration, what is the difference between the newly created Addiction Services Director and the efforts performed by the Substance Use Services Program.
Madam Chair, I don't know if Dr. Smith is on the line. Perhaps Ms. Wilmot may be able to address that. If not, we will have to follow up and respond accordingly.
Okay, and through the chair, additional question on this topic. Why is the Addiction Services Director funded out of the Department of Public Health rather than through the Office of Mental Health?
Madam Chair, that was done organizationally to have the entire 8-person task force as a functional unit of our public health department. The funding is coming from our Office of Mental Health, and the budget does reflect that interdepartment revenue, but that was done for organizational reasons.
Thank you. Through the chair to the administration, how many county Office of Mental Health positions are funded in the 2021 budget?
Madam Chair, I don't have that number in front of me, and consistent with my prior responses regarding the funding of positions, this budget adequately authorizes positions and adequately funds, from an appropriation perspective, the salaries needed to carry out each program services.
All right, thank you. Through you, Madam Chair, given that to the administration, given that the Office of Mental Health Director position, I believe it's been vacant since May of 2019, who is running the division and who is responsible for day-to-day operations?
Madam Chair, Ms. Wilmot, along with Deputy County Executive Crossdale for Human Services, are sharing in that responsibility.
Thank you. Through the on page 195, through the chair to the administration under the Office of Mental Health, the legislature did authorize additional funding for the FIT program in order to provide mental health assistance to those facing crisis. Can you give a brief description of how the FIT program has changed since that allocation of funding, things like operating hours, days per week, number of people, et cetera?
Madam Chair, I would defer to Ms. Wilmot for that.
Hello, this is Kelly Wilmot again with the Office of Mental Health. I might need to ask you a question back, in that I think that was the approval for funding that the city was putting forward for the FIT program, and I'm not aware that was ever that ever actually happened. I don't know that was received.
Through the chair to Ms. Kelly, the legislature did authorize a $100,000 transfer in the budget, so that's the money I was referring to.
Okay, thank you. Thank you for clarifying.
Yeah.
Kelly,
can I start, and then this is Corinda Crosdale. Can I start, Kelly, and then hand it off to you?
Of course.
So one of the things that the county executive talked about when that legislation was brought before the legislature and during the press release was that we were going to be taking a look in the short term at behavioral health services, starting with the FIT team. We did put together a 90-day task force. One of the things that we didn't want to do was just put money into the program when we knew from a systemic standpoint that there were breakdowns in the behavioral health system in its totality. So we wanted to look at how we triage calls coming into 911 for behavioral distress, which could involve the FIT team. It could involve another team, such as a mobile crisis team. It could involve going to 211 for intermediate crisis. It could involve going to 911 in conjunction with the FIT. So before we just redesigned the FIT, we wanted to make sure that it fit into the system holistically. The second phase of that was looking at what was coming out the race commission and how that fit into our longer-term goals. Kelly is working in combination with the race commission on the 90-day task force and on a newly introduced office through the city, looking at, I believe, the CAHOOTS model. So this isn't just about staffing up fit, but it's looking at our entire system and how it interacts together. So with that, I'll turn it over to Kelly because she's been working on the details and pulling in that community voice to make sure as we build this that we're hitting the mark.
Thank you, Corinda. I really wouldn't add a whole lot to that. I think that's a nice summary of the work that has been happening. That in addition to FIT, looking at, other diversion options that we might have within our community that would involve the non-law enforcement responses to people who are in mental health crises in the community. But I would concur with everything that Corinda just reported out.
Thank you. Through the chair, just for clarification purposes, I believe I heard you say that the city did not come through with the $350,000 that was publicly announced.
Correct, Madam Chair.
Thank you. And then just to trying to be simple here, it sounds like no changes have been made to the FIT team through the chair to the administration, because you're still studying an overall solution for mental health. Is that correct?
I believe that would be an accurate assessment, and I would highlight that piece of pulling in the community voice. As we know, inner city impoverished communities are more impacted by this program than any other community in Monroe County. So we wanted to make sure that as we build this, it's meeting their needs.
Understood. Through you, Madam Chair. So what has happened to the $100,000 that the legislature authorized?
Madam Chair, that transfer has been made in the budget, and it is available. If I can be frank, I believe the grant award that the county received, that this legislature will be seeing in the next cycle, is probably sufficient for the near term. Of course, that other expenditure would expire at the end of the year. I'm sorry, that other appropriation would expire at the end of the year.
Through the chair, when you say the other appropriation, you're specifically referring to the $100,000?
I am, Madam Chair, that use of the contingency fund.
Thank you. Give me just 1 second. I may have to come back to this a minute. Through you, Madam Chair, what will happen if that $100,000 is not spent during fiscal year 2020? It vanishes?
Madam Chair, appropriations from the operating budget generally expire on December 31st.
And that, through you, Madam Chair, and I'm sorry for being dense here, I don't quite understand. Does that just mean that the county finishes $100,000 less spent for the year and it goes over to 2021 as something, or?
At least underspent on that particular appropriation line, Madam Chair.
Okay, so
this would, this would either we account for our expenditures on an income statement. An appropriation is not an expenditure. Therefore, if we did not incur the expenditure, we would not have that expenditure reflected on our income statement.
So through you, Madam Chair, the $100,000 that the legislature approved, I believe in July, could end up accomplishing nothing when all is said and done.
I don't know that, Madam Chair.
All right, I'll follow up on this in Ways and Means. Through you, Madam Chair, what additional funding I'm sorry, I already got an answer to this one. On page 195, earlier this year, it came to the public's attention that the employee overseeing the FIT program had vacated the position. And I think you already answered that one too. I'm sorry. Let me move ahead. Through you, Madam Chair, on page 195, through the COVID pandemic, what programs have had to transition to remote operations for interfacing with relevant residents? Things like developmental disability services, substance use, what programs of those nature?
Madam Chair, I would defer to Ms. Wilmot for that.
Thank you. This is Kelly Wilmot again. A number of our providers through our 3 disability areas, so mental health, substance use, and for persons with intellectual and developmental disabilities, a number of providers did transition to providing remote care. Residential placements continued to operate with some restrictions in place related to visitation. Over the summer, as there was a decline in COVID within the community, we saw a return to more face-to-face contacts. Visitations were resuming as well with families. We're seeing that being dialed back currently, given the surge of cases that we're experiencing at this point in time. But we have worked closely with all of our providers, and they have made smooth transitions to the use of telephone and televideo options.
Thank you. Through the chair, how have those changes that you talked about just now impacted the budget for this division, if at all?
There's not been an impact on the budget at this point.
Okay. Through the chair, on page 517, line 504,800, agency contracts. How much funding is being budgeted for the FIT program in that? Was I not heard?
I'm sorry, Madam Chair. I just responded and I was on mute this whole time.
Yeah, I can't tell if I'm moving.
Madam Chair, I believe the Office of Mental Health is still finalizing how they are allocating the dollars within their priority services. I don't believe that's been final yet.
Through the chair, can we get that when it is final, please?
Yes, Madam Chair.
And aside, through the chair, aside from the grant that you already mentioned, Mr. Franklin, do we anticipate any additional funding to this line in the future?
Additional funding, Madam Chair, for this particular line in the future would be dependent upon allocations by the federal government to New York State and how they incorporate that into their own state appropriations for allocations to the counties. Very difficult to forecast that at this time.
Thank you, and that's fully understandable. I return the floor to you, Madam Chair.
Follow up to Legislator Hebert's questions in regards to the FIT program. You stated that there was a 90-day task force. Where are you in the 90 days, and when do you expect to have results to share from this task force?
Madam Chair, can you please repeat that question?
Oh, absolutely. So it was mentioned that there's a 90-day task force. I was just wondering where you are in those 90 days. When did you start the task force? And when do you expect to have the results to share from this task force?
Madam Chair, we'll have to defer to Ms. Wilmot.
Thank you. Through the chair, the 90-day task force work started in September, and we are wrapping that work up with our work groups in the middle of December. We are anticipating providing a report to the county executive by the end of December.
Thank you. Looking under the Department of Public Health, I just want to congratulate, it looks like they've accomplished many of their 2020 major objectives and have quite a list of accomplishments. In the midst of the pandemic, you know, so I'm very happy to see that. I see some were moved on to 2021 objectives. Was this due to COVID?
Good evening. This is Dr. Maria Elena Velez de Brown, Deputy Commissioner of the Monroe County Department of Public Health. Through the chair, could the legislator give an example of one of those areas? I'm not sure to which she's referring, please.
Oh, sure. You're gonna have to give me a minute to find my notes.
Absolutely.
All right. Why don't I go on to the next question? I'm going to come back to that one. What percentage of the Department of Public Health budget is mandated and non-mandated?
Madam Chair, I can follow up with that prior to your December meeting.
Perfect, thank you. And then how much, if any, general fund balance is being applied to the Department of Public Health budget? And if general fund balance is being applied, what is the breakdown of restricted versus unrestricted applied fund balance?
Madam Chair, for the proposed 21 budget, there is no use of fund balance within the Public Health Department.
Great. On page 266, they reduced down almost all the lines. But does spending on salaries and compensation achieve the staffing objectives, and to what cost to programs were these decreases?
Madam Chair, yes, this particular page shows a whole lot of decreases. Predominantly the reason for that is the amended budget for 2020 includes a whole host of grants that were accepted by the legislature during the year. Looking just at personnel services, of the $9.795 million in the amended budget for 2020, at the time this budget book was produced, $1.6 million of that was due to salaries covered under grants, which if you back that number out, the proposed budget is actually running a little higher than the amended budget minus those grants.
Thank you. Again, on page 267, administration and special services, personnel services went up by 1.9. Did the increase, was that due to headcount?
Madam Chair, in addition to the normal pay and step increases, this is the division that includes the 8 FTEs for the new Addiction Services Task Force.
Thank you. On pages 269 and 521, under the nursing services, personnel services, went down by 1.4 million. Why the decrease?
Madam Chair, of this $1.39 million salaries you see in the amended budget, $769,000 is attributable to the grants accepted, and we do expect this legislature to receive referrals during 21 to accept the same or similar grants.
Thank you. On page 268, how many individuals have been reached and assisted through the Opioid and Addiction Services Task Force?
I'm sorry, Madam Chair, can you please repeat that question?
Absolutely. How many individuals, so on page 268, how many individuals have been reached and assisted through the Opioid and Addiction Services Task Force?
Madam Chair, I guess I will have to defer to Ms. Wilmot for that question, although I do know they are not direct service providers.
Yes, this is Kelly. I don't have a direct answer to that question. The NCADD convenes the task force if that's the task force that you're referring to, and so that's a joint meeting to hear about all the various community efforts. And our office does provide Narcan training, and we certainly report out on that through that task force. We've continued to do that virtually. Since April, we've trained over 200 people virtually for Narcan administration.
Thank you. On page 519, under Public Health Administration and Special Services, under the salaries line, the 2021 budget shows a significant increase in salaries. Does this include the newly created Chief Community Engagement Officer and Addiction Services Director positions?
It does, Madam Chair.
Can you provide a job description for the new positions?
Madam Chair, I'll have to obtain that for you and follow up accordingly.
Thank you. In the past year, individuals carrying out similar duties as the Chief Community Engagement Officer position received a significantly lower salary. Why do you believe this position warrants a salary this high?
Madam Chair, I'm not sure to which county employee you're referring to that carried out the same function as a Chief Community Diversity Officer.
Can you explain what duties they perform and who reports into them?
Are you talking about the new Chief Diversity Officer position? Oh, I'm sorry. I apologize. The Chief Community Engagement Officer.
Yes,
so,
thank you.
I apologize. I mixed the two positions. So this is a newly created position. These functions were not performed in the past. I started with the county in 1995. I don't recall anybody reaching out to the community to this level, to this extent, and in this manner as this new position. The intent is to connect us better to community needs. We often make decisions based on hearsay from providers, not so much from the constituency that we actually serve. So this is kind of combining that voice of the users of the system and the providers that we fund to provide that direct service. So yeah, this isn't something that the county has done in the past.
Thank you. Through the chair, to Mr. Franklin, on page 519, Public Health Administration and Special Services, under the agency contracts line, what types of contracts are generally included on this line, and why are we not budgeting for any of these contracts in 2021?
Madam Chair, the big spend you see in the amended budget for 2020 has to do with our COVID response, and that was really the isolation hotel. I guess what I believe you call typical contracts would have been those services funded through a grant. That's why our budget typically would start off with 0, and then the referrals we bring to you throughout the year would amend this particular line.
Thank you.
Are you all? I wasn't sure if you were done. Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, on page 521, under Public Health Nursing Services, so the 501,000 under salaries, the amounts budgeted for salaries and benefits is significantly less than it has been in past years. Is this because of federal and state aid, or is something else driving this?
Madam Chair, the real reason is the amended budget for 2020, 1.388 million, 769,000 was amended the budget due to a grant. We do expect those grants to come before the legislature throughout 21 as well.
So, I'm sorry, I just want to make sure I'm understanding through the chair. The rest of the salary position, or the salary is funded through grant money. Am I understanding you correctly?
Yes, Madam Chair, the 644 you see in the proposed budget is, I guess I'll call that tax supported. And then what you see in the amended budget was an additional $769,000 of grants that supported the rest of the staff salaries.
Got it. Thank you. And I'm good for now. Thank you, Madam Chair.
Legislator Colby?
Legislator Colby, you have the floor.
Thank you, Madam Chairman. The Public Health Environmental Health Services on page 527, I believe, and it's line item 501000, salaries. The amount budgeted for salaries is less than the past year. What is the reason for this?
Thank you, Madam Chair. Similar to the prior page, the amended budget for 2020 includes grant funding of $359,000. Again, we do expect the same or similar grants to be brought forward during 21.
Thank you. I'll turn it back over to you, the floor.
Legislator.
Legislator Wilt, you have the floor.
Thank you, Madam Chair. Through the chair, on page 665, revenues, public health, nursing services. Why are we expecting to not receive federal aid for nursing services when we have received it in both 2019 and 2020?
Madam Chair, that federal aid is related to immunization and STD grants. Again, we do expect to come forward during 21 with referrals to accept similar funding.
Thank you. I return the floor to next legislature.
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you. Through the chair on to the administration on page 721 under public health personnel. There appears to be the addition of an engineer under public health personnel. Is this position under the environmental health division?
I believe, Madam Chair, we still have Frank Alisano, Assistant Director for Public Health, on the line.
Through Madam Chair, yes, the engineering position is a position that will be in the Department of Public Health.
Is it under the environment?
In environmental health.
Environmental health. In environmental health.
Yes.
Thank you. Through the chair, why was this position created?
The position, through the Madam Chair, the position was created because we did not have a succession plan to establish engineers within the public health department. So this is kind of an entry-level engineering position.
If through the chair, could you just give a brief description of what duties this person will carry out if they're net new and additional, which is what I think I heard?
Through Madam Chair, I can send you a job description if you'd like.
That's fine. Through you, Madam Chair, on page 721, again, public health personnel. It appears as though the senior administrative analyst position is being changed from a group 15 to a group 14. Can you explain the rationale? Is the position filled? Is it filled? Are they taking a parakeet or is it a new person?
Through Madam Chair, the position was a 15, it was now a 14, and some of the responsibilities moved into other areas, which justified a lower group.
So through the chair, is the person that was in this position changed, or are they taking a pay cut?
Through Madam Chair, the position was vacant, and we just recently filled the position.
Thank you. Through you, Madam Chair, on page 721, again, same topic. The number of public health nurse positions appears to be decreasing by 2. The number of registered nurse positions is increasing by 2. What is the reason for the title changes? Because it looks like the salary schedule is the same.
Through Madam Chair, the positions probably roughly around 10 years ago, there was public health nurse positions. It was a unique position that was created, and as we've learned over the recent years, it was very specific on the qualifications. So we moved to a more general registered nurse to get more qualified applicants for our department.
Understood through you, Madam Chair. What divisions do each of these titles operate out of?
Through Madam Chair, they're actually in our TB immunization, and there's some in our disease control EPI division. There's some in our Starlight pediatric division.
Okay, through you, Madam Chair, on page 7021 again, for public health personnel, it appears there's been an additional senior public health emergency preparedness position created. Was this position created in response to the COVID-19 pandemic?
Through Madam Chair, the position was an upgrade from a previous position on our public health preparedness to get a higher quality position candidate.
So,
but yeah, it was. I mean, yes, so you could say it was because of the crisis.
Okay, so if that's the case through you, Madam Chair, when the COVID-19 pandemic eventually ends, do you anticipate the position being eliminated from future budgets, downgraded? What do you expect?
Through Madam Chair, no, we don't anticipate it to be eliminated or downgraded.
Okay, through you, Madam Chair, is the position filled now?
Through Madam Chair, we have one of the positions, actually, both of the positions are vacant right now, but will be filled within, the posting is out for both of them right now. There was personnel in those positions. However, they moved into different roles within the public health department.
And just to be clear, through you, Madam Chair, I am talking about the senior public health emergency preparedness position. And I heard you respond with positions, so I want to make sure we're talking about the same thing.
Yeah, there's hang on one second, please. There is 2 senior public health emergency preparedness specialists through Madam Chair.
Thank you. Through you, Madam Chair, same page. In your budget presentation, you mentioned the 3 new service coordinator positions for the early intervention program. And that just to be clear, is that reflected in the additional senior assistant health services coordinator and the 2 additional assistant health service coordinator line item?
Through Madam Chair, yes, that is.
Okay, thank you. Same page, same topic. If it appears as if there is addition of a new title, Senior Research and Data Analysis Coordinator. Can you either give us a brief description of this position or a job description later on?
Through Madam Chair, yes, I can. That's part of the new addiction services team, and they'll be focusing on data, providing data for the team.
Okay. Could you please, through you, Madam Chair, could you please provide a job description for that position when you get an opportunity to do so? Again, not a crisis.
Through Madam Chair, yes.
Through you, Madam Chair, on page 721, same topic. It appears that several positions have been eliminated, including a grants coordinator, public health emergency prep specialist, an information officer, a public health STD assistant. For each of these positions, are those positions currently filled or are they currently empty?
Through Madam Chair, no, those were all positions that were vacant and that were actually restructured into different job titles within the public health department.
Through you, Madam Chair, was that part of the COVID-19, shall we say, reset?
Through Madam Chair, no, actually those positions have been changing over the last couple of budget years.
Thank you. Through you, Madam Chair, is there someone else within the Department of Public Health who's responsible? Oh, I'm sorry, you already answered that. Moving on. Same page. There have been many high-paying administrative level positions added to the public health budget, it appears. Why and what benefits are we expecting to achieve? What accomplishments are we going to achieve by adding these positions?
Through Madam Chair, can you be more specific on the exact positions? Because our medical positions have stayed the same. We have in the last couple of years increased our nurse practitioners, which obviously serve the Starlight Peds.
I'm going to have to go back and look at that. I don't want to take up that time. I still have many questions left to go. On page 727, same topic. There are 3 associate medical examiner positions. Are they currently filled?
Through the chair.
Through Madam
Sorry, go ahead, Frank.
Oh, through Madam Chair, there's one of them is filled, 2 are vacant.
And in a prior meeting, I had asked about a couple of employees that were using those titles in lieu of. Are they still accounted for in these positions, or are these positions funded elsewhere? Are the 2 people that are in these positions funded elsewhere in the budget?
Madam Chair, those positions are all cleaned up in the 21 proposed budget.
Thank you. I yield the floor.
Yes, I wanted to go back to the question I had earlier. I know you guys wanted more specific. So when I was looking at the 2020 budget, page 284, you had listed the administration and special services major objectives were selected new health information record system, present a summary of the accessible preparedness series and provide a workshop at the 2020 National Association, and then conduct a Greater Rochester International Airport Ebola virus tabletop exercise. What I was trying to get at was I see all 3 of these major objectives that you had for 2020 are now major objectives for 2021. And the question really just came down to why they got pushed over to 2021, and was it due to COVID?
Through Madam Chair, yeah, they were pushed to 2021 due to COVID.
Okay, and did you have a chance to work on any of those objectives this year? I know not completed, but I didn't know if you had a chance to actually work on any of those.
Through the chair, would you please list those again so we can answer specific to them?
Can you repeat that one more time?
Sorry, it's Dr. Velez de Brown. Would you please list again the objectives?
Oh, sure.
So we can respond to
Yep. Select a new health information record system, EMR, for the Department of Public Health. Present a summary of the accessible preparedness series, provide a workshop at the 2021 National Association, and then conduct an airport highly infectious disease tabletop exercise. In 2020, that was for Ebola, but I have to imagine now for 2021, you're going to be including COVID.
Yes, ma'am, through the chair. So we have made significant progress in moving towards obtaining a new electronic medical record that will meet the needs of more of the programs within our department. Our accessible needs presentation, that entire conference went virtual, so our staff were able to present some of their work, but the hope is to be able to do a fuller job of it next year. And give me 1 second, I'm being texted more information as we speak. And the Ebola exercise will be rescheduled to next year. I anticipate we will be mandated to include COVID activities within that exercise.
Great, thank you so much for answering that. Under the Monroe County or Monroe Community Hospital, what percentage of the Monroe County Hospital budget is mandated versus non-mandated?
Thank you, Madam Chair. I'd be happy to provide that information in a summary with the other departments that I've already committed to.
Thank you. How much, if any, general fund balance is being applied to the Monroe Community Hospital budget? And if general fund balance is being applied, What is the breakdown of restricted versus unrestricted applied fund balance?
Madam Chair, I'm just getting over to the MCH page, make sure I adequately answered that question. Sorry for that delay, Madam Chair. We are appropriating fund balance within Monroe Community Hospital. It is a small amount, $16,000 and change, and it is coming from our reserve for bonded debt for specific MCH capital projects. There is, Madam Chair, on page 217 of the budget book, I believe I included this in my presentation for MCH, net county support for the hospital, $3.5 million requested for budget year 21. We don't show this as appropriate fund balance. Net county support in budget books, if you add up all the departments with net county support, it equals the tax levy. So this basically is very similar to a general fund. Well, it's not similar to. This subsidy is a general fund transfer to the hospital fund.
Thank you. Are there any capital projects included in the 2020-2025 capital improvement plan and funded as part of the 2020 capital budget been delayed, downsized, or canceled as a result of the appropriation restrictions imposed due to the county's financial position as a result of COVID-19 pandemic? And if so, can you please provide this committee with a list of those affected projects and revised budgets and project timelines?
Madam Chair, there will be no revisions to budgets. The number of capital projects in MCH and frankly across the county, we pressed back on capital spending pretty hard earlier in the year. Much of those capital funds are now moving forward as originally intended.
Thank you. What is the hospital's current debt position and what steps are being taken to reduce that deficit?
Madam Chair, I heard debt and deficit in the same sentence, and I usually don't talk about both, but let me address the continuing net deficit position of the hospital. It's roughly $30 million. It has been that for several years. Frankly, Madam Chair, this is the major reason why I sought the legislature to approve a general fund subsidy of MCH operations. I believe this is 21 will be the third year, and I'm seeking for this body to approve the increase to $3.5 million. I think it's absolutely critical that this county actively address the net deficit position of MCH. Our credit rating agencies consistently report that is a credit weakness of the county. Generally speaking, investors and credit rating agencies don't like to see the general fund subsidize any enterprise operation. So the fact that our hospital has a net deficit position is a little concern to them. This general fund subsidy is one way to speed up overcoming that net deficit position. Some of the members of the committee and some of the members of the legislature haven't been on the legislature that long. I will remind everybody 3 times since 1994 with an Ernst & Young report and then a 2004 budget advisory team and a subsequent 2005 CCE, the Committee for Civic Entrepreneurship. All 3 bodies have recommended that the county sell Monroe Community Hospital. It is a community gem. I don't think anyone here on this line is really interested in selling this hospital, but it's time to either fish or cut bait. If we're going to value the services that MCH provides, I think it's time we stand behind it and help it get out of this net deficit position for the betterment of the hospital, for the benefit of the general fund and the county's financial position overall.
Thank you. Does the 2021 proposed budget allocate any cash capital for county DOT projects? And if, whoops, the hospital, sorry. If so, why was the decision made to use cash capital instead of additional debt services?
Madam Chair, there are no cash capital funded projects within Monroe Community Hospital. Did you want to talk about transportation?
No, that's all. It was a hospital, sorry. And I'll yield the floor if any legislators have questions around the community hospital.
I'm sorry, Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you. Through you, Madam Chair, on page 531, staying with Monroe Community Hospital, line 501005, temporary help. Could you please explain what accounts for the decrease in temporary help from the actual figures in like 2019?
Madam Chair, the budget going into 2021 for temporary help is really trying to be adjusted based on recent historical performance on this line. It is not necessarily the result of trying to bring on more part-time help or trying to reduce the part-time help. It's really just trying to align the budget from where we've been spending.
So through you, Madam Chair, just to make sure I'm clear, so it's basically just realignment based on actuals.
Well, that was a lot shorter, but yes, Madam Chair.
Right. Thank you, Mr. Franklin. Through you, Madam Chair, on page 533, line 505020, computer software. Could you just explain the increase? What's covered by the funding, and is this just a computer refresh or what's going on with this one?
Yes, thank you, Madam Chair. This is a change. This particular budget line going forward has dollars moved to it from the maintenance of computer equipment line. That is, of course, now I'm not going to see it on this page, but that was a different general ledger account. Basically, what I'm trying to say is we moved appropriation out of the maintenance of computer equipment into this particular line, Madam Chair.
Understood. Thank you. Good answer, as always. Same page, line 505085, medical lab supplies. Why are we budgeting for a significant decrease on this line from past years?
Madam Chair, the 2020 amendment budget really is inflated due to the CARES funding received both by the hospital and the CARES funding received into the county general fund that was supporting other hospital expenses. I think that is a significant part of the decrease, but also, oh my God, Madam Chair, I just lost my train of thought. I think I might be better off to follow up on this question before the legislative meeting.
That's perfectly fine. Thank you, Mr. Franklin. Next question, please. Through the chair, has the COVID-19 CARES Act funding in 2020 impacted the medical supplies on hand at Monroe Community Hospital?
Madam Chair, I'm looking for the Executive Director, Alyssa Tallow, to see if she's on the screen. I don't see the name on my screen, but...
I believe she's on the line. She's muted at the moment.
If Executive Director Tallow is on the line, I would like to defer to her.
This is Alyssa Tallow from MCH. Through the chair, we have actually done very well in maintaining our medical supplies. We have allocated CARES money to cover the cost of supplies, and we've also relied on the Office of Emergency Management to supplement what we have, since there is a regulation through the New York State Department of Health that all nursing homes have a 60-day supply on hand.
Thank you. I yield the floor.
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, on page 671, under revenues for Monroe Community Hospital, line 43,000 under federal aid. Are there any positions, processes, or essential services at MCH that are dependent on federal aid?
No, Madam Chair. This particular federal aid line, at least in 2020, reflects the referral passed by the legislature April or May for the specific CARES Act allocated to MCH.
Thank you. And then on that same page through the chair, line 406115, charges to other governments. What's included on that line?
Madam Chair, this particular revenue appropriation line reflects the Medicaid upper payment limit. This is that state DOH, federal CMS negotiated funding of non-state owned and operated hospitals. This is the one that is really projected to go down. It can be somewhat volatile.
Got it. Okay, thank you. And through the chair, back under appropriations on page 532 for Monroe Community Hospital, the line, it's 504035, occupational exams. Can you just kind of give a synopsis of the fluctuation on this line that we see?
Madam Chair, this answer actually pertains to any department that you're going to ask this question about. The occupational exams can fluctuate quite a bit from year to year, depending on the amount of hiring taking place. And we don't often talk about this. Sometimes staff may come to work drugged or otherwise impaired, and they have to be referred to strong OCMED for a drug test.
Got it. So those are included on that line then as well, through the chair.
Yes, Madam Chair.
Okay. And then I'm assuming any new hire drug exams would then also be included in that?
Yes, ma'am.
Okay. Okay. Got it. Thank you. And on that same page through the chair, under maintenance, so the 504280 on maintenance buildings, can you tell me what services we're planning to use this this money for, and the cause of the increase?
I'm sorry, Madam Chair. Maintenance of buildings, is it?
Yeah, maintenance buildings. It's the same page, 504280.
I do have a note, Madam Chair, that we've tried to more appropriate budget this particular appropriation based on historical averages we've seen over the past 3 to 4 years.
So just costs are increasing, or historically maintenance costs have increased? And
yes, Madam Chair, you know, it's a pretty old building in a constant need of being updated, and there's always things changing.
Got it. Okay, thank you. And with that, I'm done. Thank you.
I was wondering if we could get an explanation how the COVID-19 pandemic has changed operations at MCH, and how has it impacted the way we're budgeting in 2021?
Madam Chair, if I may defer to Executive Director Alyssa Tallow regarding the hospital's operations.
Yes, this is Alyssa Tallow from MCH. Through the chair, we've seen many changes, obviously, in nursing home care throughout the COVID-19 pandemic. I think we have done the best that we are able to in order to absorb and be fluid in what we can when we can, which includes, having different meetings with different disciplines more frequently, so that we can really gauge how we can admit people to our facility, where we need to look at, how we screen folks, as well as how it even comes down to staffing our facility. So I don't think any area of our operations has remained untouched by COVID-19. I probably could talk for hours about how it has impacted. I think that, when we were looking at budgeting, it's like looking into a crystal ball right now. And in the late summer, when we were starting to prepare the budget, we were looking at how things might change even in 2021, prior to sliding back into a higher positivity rate in the county. So as far as how we move into 2021 for the budget, we will continue to do what we can, as far as census maximization, supply costs, and even looking at what kind of funding there is available to nursing homes moving forward, since most nursing homes will be in a similar position as us.
Thank you. Given that MCH has a concentration of high-risk individuals, what, if any, funds has the hospital allocated for a plan to distribute the COVID-19 vaccine?
Through the chair, there's actually 2 programs that are now being at least talked about. I know a vaccine has been touted that it might be coming. There is a program through the CDC as well as through the New York State Department of Health. Both programs will offer vaccinations to healthcare personnel as well as residents. So what they have to offer at this point in time, it sounds like they will be supplying the vaccine for distribution for all of those higher risk individuals as well as staff.
Thank you. I yield the floor. Any other legislators have questions?
Legislator Witt.
Legislator Wilt, you have the floor.
Thank you, Madam Chair. I'd like to talk a little bit about the Veteran Service Agency. Through the chair, what percentage of the VSA budget is mandated versus non-mandated?
Madam Chair, very happy to follow up with my list of all the other in that regard.
Okay. You'll forward that on then, right?
Yes, Madam Chair.
Through the chair, how much, if any, general fund balance is being applied to the VSA? And if general fund balance is being applied, what is the breakdown of restricted versus unrestricted applied fund balance?
Madam Chair, the proposed budget for 21 does not contemplate use of appropriate fund balance.
Is there a reason for that?
Madam Chair, our use of appropriated fund balance across the various departments have been dependent upon whether or not we have recently issued a bond anticipation note that we are fully redeeming through the debt service fund, or the use of our reserve for bonded debt for capital projects associated with that department. And our Veteran Service Agency has none such borrowing.
Okay, thank you. Some appropriation questions. Through the chair, on page 535, commissary, what is covered under this line item?
Madam Chair, the Veteran Service Agency budget for commissary, generally speaking, provides refreshments for advisory board meetings and for those veterans using their internet cafe.
Okay, thank you. And through the chair, again on page 535, Veteran Service Agency appropriations, 501,000 salaries. While full-time equivalencies are remaining flat, salaries are increasing by nearly 10%. What is the reason for this?
Madam Chair, our Veteran Service Agency staff are receiving nothing but the expected pay and step increases in their collective bargaining agreement. I will, however, also follow up to see if there was any expected vacancies in 2020 that my answer is not accounting for.
Thank you. And through the chair, can you please provide a breakdown of the cellular telephone appropriations for the department? What the devices are being issued in the department, mobile, Wi-Fi, access points, or cellular phones, and the personal titles of all within the department who are issued cellular phones or mobile Wi-Fi access points?
Yes, Madam Chair.
State your answer.
Yes, Madam Chair.
Through the chair, can you please provide a breakdown of travel appropriations for all divisions within the Department of Human Services with appropriations on this item line? What travel is planned? What conferences are planned to be attended?
Madam Chair, can you please clarify that question? I'm not sure I understood.
Okay, through the chair, can you please provide a breakdown of the travel appropriations for all divisions within the Department of Human Services?
Madam Chair, the travel appropriations in each of the Division of Human Services are presented in this budget book. They are all presented on General Account 504005 within the appropriations detail, end of page 400, spilling over into page 500.
Okay, and can you tell me what travel is planned and what conferences are planned to be attended?
Yes, Madam Chair. Yes, Madam Chair, we will provide that.
Thank you. I relinquish the floor.
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you. Through the chair, on page 332, it appears that the VSA is seeing fewer ex-military personnel and yet receiving more benefits. Could we get a explanation / description of how that's happening?
Madam Chair, if I may defer to County Service Director Nick Stavanovich, if he's on the line. And if not, we can follow up, Madam Chair.
Okay. A couple of these additional questions also probably require his follow-up. Through the chair, do you feel the department has the necessary resources to respond accordingly to the COVID-19 pandemic?
Madam Chair, I will have the Director Stavanovich follow up. Oh, Madam Chair, looks like Mr. Stavanovich is on the line, just working to get off mute.
You know what name he might be under?
We are working on that.
Understood.
Madam Chair, if the legislator would prefer, we'd be happy to field those questions in writing and respond accordingly.
That would be acceptable through the chair, as long as it is before the Ways and Means Committee, which is early, next week, mid next week.
Madam Chair, I'm hearing that Mr. Stavanovich is trying to access the Zoom video link.
Yeah, we're just working on it now.
I think, Mr. Stavanovich, I think you're calling in from your cell phone, so if you hit *6, that should unmute you. So you have to unmute yourself, we're not able to unmute it. Says he's joining. He's joining.
While we're waiting for him to join, I have a couple other questions that Mr. Franklin may not need him for. If I may, I'll try to proceed. Through the chair, I don't know how well known it is, but I work very closely with the Veterans Outreach Center. There are 3 legislators on that are former military personnel, Legislator Alcoffer, Legislator Wilt, and myself. And we all try to work as closely with them and the VSA as we can. I know that the Veterans Outreach Center has specifically requested a VSA service officer be assigned to work at the VOC, physically have their desk at the VOC to assist with Veterans Administration and other veterans claims. I know that in talking to Laura Stradley, they are currently unable to help several veterans a week that come in looking for that assistance, and it might even be dozens of veterans a week. I know that there isn't anybody right now, at least I don't believe there would be at the VSA, who could be taken out of their current job and put over there. So I'm looking for the addition of additional.
Can anyone hear me? This is Nick Stefanovic.
Yes, we can hear you.
Welcome, Mr.
All right.
Yes, I'm just asking a
Sorry
question,
about that.
Mr. Franklin. Is filling this roughly $40,000 position something we are able to do or plan to do, or how could we do it? I know that the 3 veteran members of the legislature are all thoroughly behind doing this. That was
Madam Chair, so when Mr. Stavanovich joined us, you kind of got cut off there.
I'm here.
Is there a specific request? I'm hearing the filling of a position, but I'm not.
I can net that out to a much quicker statement. The VSA works closely with the Veterans Outreach Center. The VOC has requested a VSA service officer be assigned, and I'm pretty damn certain that Mr. Stavanovich hasn't got one that he can give them, because if he had, he would have already done it. I know there are a number of veterans whose VA claims and other filings are not being done and handled in a timely manner. And I believe we need to add another service officer to the VSA, which is roughly $40,000. At least that's what I believe to be the case. I might be off on the number. Is it something we can do?
Madam Chair, the legislature appropriates funds, authorizes positions, and levy taxes. That is certainly within the purview of this legislature.
Okay, so I believe I just heard you say through the chair, put in an amendment or something of that nature.
Yes, Madam Chair.
Thank you. I have another question of a similar ilk. I know that some of the administration attended a presentation by Tribe, which is an ecotherapy pilot program to assist veterans struggling with suicide and overdose. And I believe I've heard rumors that the people who heard that in the management positions were extremely impressed. This pilot program would cost approximately $125,000. It involves a wilderness therapy program, which has proven elsewhere to be highly successful. I can tell you that I know of at least one local vet that lost their life this week at their own hands, and $125,000 seems inexpensive to me. Is this another thing we should pursue via amendment?
Madam Chair, I think anyone here would be hard pressed to argue against veteran services. This legislature can do such an amendment. I would like, Madam Chair, perhaps not on this call, but later on, if the legislators and I could work together to perhaps identify appropriate funding, whether from funding within the county or from other sources.
I'd be thrilled to do so, and I'd like to involve Mr. Stefanovic as well. Nick does, in my opinion, a fabulous job at the VSA, and they have an amazing working relationship with the VOC. It's uncommon based on my experience. So now I will return to the questions we needed Mr. Stefanovic for. On page 332 of the budget, it appears the VSA is seeing less people and receiving more benefits. Through you, Madam Chair, could I get an explanation for how that's happening?
Yes, through you, Madam Chair, it's Nick Stefanovic from the Veteran Service Agency. First, I'd like to apologize for the technical difficulties. But this is the same as in every year before. It's always very inconsistent in matching the amount of clients that we see with the amount of money that we bring in due to the nature of retroactive payments. What I mean by that is when veterans file appeals, they can be sitting in the appeals mode for 7 to 10 years at the worst. And when we win one of those cases, for example, we had a case this year where we won $1 million for a veteran. So things can really jump around on the page. So it's not always the more clients we see, the more federal payments we bring in.
Thank you. Through you, Madam Chair, do you feel your department has the necessary resources to respond accordingly should the COVID-19 pandemic continue?
Yes, through you, Madam Chair. I think that I've never been more proud to work with a department and with a staff through a crisis like this. And I can say confidently that we have been able to meet the needs of the veterans, at least at our level. You know, we've been innovative in how we've done it, making sure that we're taking precautions. However, even organizations like VA and VOC seem to have been more restricted than we have in being able to service these veterans. As another example, VA now, their transportation system has really been stopped due to COVID and lack of preparedness for that. So they are calling our agency to have us transport vets to their appointments. So in summary, I would say that I am very comfortable and confident in the resources we're being provided so far.
Understood. I think this might be my last question for the evening on the budget. Through the chair, the PFC Dwyer Peer Support Program is something that has proven highly successful over years. It is a inexplicably seem to be a target of the state government's budget. What funding is there for the program going into 2021?
Through you, Madam Chair, the PFC Dwyer program, there's always been confusion in the budget over which budget it's going to be in. I know this year the last word that we have gotten is that there is hope that the funding will remain unless somebody else at the county has heard differently. But the last thing that anybody wants to do, obviously, is to cut veteran services. However, we have prepared if that cut does come down. We've worked with Compeer, Sarah Passamani, who's the president of Compeer, and come up with a plan to replace funding through other avenues such as Compeer and private donations to make sure that the program will continue. So regardless of what happens with the state funding, that program will continue.
Thank you. Before I yield the floor back, I just want to thank Mr. Franklin and whoever else is in the room with him for the thorough and complete answers provided. He brings me every time we talk, and I appreciate it very much. I yield the floor.
Thank you.
Are there any other questions from the legislators? So the next item on the agenda is approval of minutes. You have the February 25th, 2020 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of day. The next item on the agenda is new business. Mr. Clerk.
Referral 20-0356, confirmation of appointments to the Monroe County Board of Health.
Move it, Madam Chair.
Second.
Moved by Mr. Hebert, second by Mr. Colby. Is there any discussion? All those in favor, please say aye.
Aye.
Any opposed? Item carries. Next item.
Referral 20-0357, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the Comprehensive Toxicology Testing and Driving Under the Influence and Driving Under the Influence of Drugs Program, Office of the Medical Examiner.
Move it, Mr. Chairman.
Second. Second.
Moved by Legislator Colby, seconded by Legislator Hasman. Is there any discussion?
Legislator Wilt.
Legislator Wilt.
Through the chair, how many residents does this serve annually?
Madam Chair, I believe we have Rebecca Hartman on from the Health Department.
This is Dr. Hartman from the Medical Examiner's Office. This grant serves the Monroe County population. I would have to look it up exactly what the population of Monroe County is, but currently it serves Monroe County at large and anybody who happens to be driving through by supporting anti-driving under the influence efforts.
Thank you.
All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0358, authorize a contract with the University of Rochester Pulmonary Group for the Monroe County Department of Public Health Tuberculosis Control Program.
Madam Chair, I'd like to declare my interest. Oh, sorry.
Need a,
Yep.
Yep, we just need a mover in a second first. Thank you.
Sorry about that.
I'll move.
Okay. Yep, moved by Legislator Colby, seconded by Legislator Hebert. Is there any discussion?
Yeah, this is Legislator Hasman. I'd like to declare my interest. I work at the University of Rochester Medical Center.
Thank you. All right, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0359, authorize a contract with the University of Rochester for support of the Forensic Pathology Fellowship Program at the Monroe County Office of the Medical Examiner.
Move it.
Second.
Moved by legislator DeFlorio, seconded by legislator Colby.
Legislator
any
DeFlorio?
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, has this program led to any participants joining the Monroe County staff to date?
Madam Chair, we have Bob Zerby on to handle that question.
Hey, good afternoon through the chair. Bob Zerby, Monroe County Medical Examiner's Office. Our program started in July of this year, actually. We did have a candidate who was seated. Unfortunately, for medical reasons, the person had to resign from the program, so currently we do not.
Thank you.
Madam Chair, this is Legislator Hasman.
Legislator Hasman, you have the floor.
I'd like to declare my interest. I work at the University of Rochester.
Are there any other discussions? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0360, authorize a contract with the Nurse Family Partnership National Service Office for support of the Nurse Family Partnership Program.
Move it, Madam Chair.
Second.
Moved by legislator Hebert, seconded by legislator DeFlorio. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0361, authorize a contract with Rochester Regional Health through its Rochester General Hospital permitted laboratories to provide clinical laboratory services for the Monroe County Department of Public Health.
Move it.
Second, Mr. Chairman.
Moved by legislator DeFlorio, seconded by legislator Colby. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0362, amend Resolution 111 of 2016 to increase the contract with URMC Labs, a division of the University of Rochester, for laboratory services at Monroe Community Hospital.
Move it, Madam Chair.
Second.
Madam Chair.
Moved by legislator. Moved by legislator Hebert, seconded by legislator DeFlorio. Is there any discussion?
This is Legislator Hasman, Madam Chair.
Legislator Hasman, you have the floor.
Just really anxious to declare my interest that I work at URMC.
Still, huh?
Thank you. Is there any further discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0363, amend Resolution 168 of 2020 to increase the contract with Quest Diagnostics Incorporated to provide employees and contractors of Monroe Community Hospital with COVID-19 testing to comply with the New York State Governor's Executive Order 202.30 as it relates to the COVID-19 state of emergency.
Move it.
Second.
Moved by legislator DeFlorio, seconded by legislator Hebert. Is there any discussion?
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair, can you tell us how much has been spent and how much has been encumbered to date?
Madam Chair, we have Alyssa Tallow from MCH.
For the chair, I can check and get back to you. We have been testing internally since the end of May and have been accumulating invoices. So I can check and get back to the legislature.
Thank you. I appreciate it.
All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0364, authorize a contract with Medical Billing and Consulting Solutions, Inc. to provide comprehensive medical billing services for Monroe Community Hospital.
Move it, Madam Chair.
Second.
Moved by legislator Hebert, seconded by legislator Colby. Is there any discussion?
Legislator
All
Hebert,
those in favor, please signify by saying,
Hold on.
oh, Legislator Hebert.
sorry for the slow response, Madam Chair. Through you
Okay.
to the administration, what other companies responded to the RFP?
Madam Chair, again, Alyssa Tallow from MCH is available.
Through the chair, we received proposals from Freed Maxic, NetSmart, who actually also supplies our EMR. Let me just pull up who else. Center's Business Office, Medical Billing and Consulting, who was the selected, and Specialized Medical Billing.
Thank you, Madam Chair. That's all my questions.
All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0365, authorize a contract with Morrison Healthcare Division of Compass Group USA, Inc. for food, nutritional, and vending services management and operation at Monroe Community Hospital.
Move it, Mrs. Chair.
Second.
Moved by Legislator Colby, seconded by Legislator Hebert. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0366, authorize contracts to provide temporary respiratory therapy staff at Monroe Community Hospital.
Move it, Madam Chair.
Second.
Moved by Legislator Hebert, seconded by Legislator DeFlorio. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0367, authorize contracts for the provision of mental health, developmental disability, and alcoholism and substance abuse services in 2021 for the Monroe County Office of Mental Health.
Move it.
Second.
Moved by Legislator DeFlorio, seconded by Legislator Hebert. Is there any discussion?
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you to the administration. When is there a plan to make the FIT team what I would call a fully functioning 24/7/365 program? And if so, could you describe briefly?
Madam Chair, we have Kelly Wilmot available to answer that.
Hello, this is Kelly Wilmot again with the Office of Mental Health. Through the chair, that is the intention. And once the grant is able to be accepted, we will plan to post the positions. And so we hope to have that accomplished early in the new year.
Thank you. Through the chair, who will be in charge of the FIT program? If not by name, by organization?
So we are, as you had noted previously, we have a vacancy in leadership at this time. We're backfilling that position, and so it will be the new community services manager who will oversee the FIT team.
Okay, thank you. Through the chair, this referral authorizes the county executive to, and I quote, execute contracts any other agency as necessary to provide mental health, developmental disability, and alcoholism and substance abuse services for Monroe County residents, end quote. Can you give us any insight on if and when other agencies have been contracted through this referral in the past? And can you also provide a list of those other agencies typically, who these other agencies typically are or in the past?
If this is Kelly again, if you were asking me to respond to that, I'm sorry, you were breaking up a bit and I didn't hear your whole question.
All right, I'll try to ask it again. This referral authorizes the county executive, and I'm not going to use quotes this time, but basically to execute contracts with other agencies as necessary to provide mental health, developmental disability, and alcohol and substance abuse services from Monroe County residents. So people, organizations not even named here could be contracted. Could you give us any insight on if and when other agencies have been contracted with through a similar referral in the past, or can you provide a list of who these other agencies typically are or have been in the past?
So through the chair, we can certainly provide you a list of all of the contracted providers. If that would be helpful, we can certainly do that.
Well, that's through the chair, that would be helpful, but I'm more concerned with what appears to be the ability to set a contract with anybody that someone in the administration chooses, because we've authorized it in this referral. And I'd like to know who those other agencies might be. Have we done this in the past? And if so, with whom?
So through the chair, that has not been my experience. All the contracts that we have awarded have gone through a procurement process. So that has not been my experience over time.
Through the chair, could someone then please explain why this language is so broad in general if we don't do that?
Madam Chair, this is Robert Franklin, just chiming in. The full list of contracts that is included as an attachment to this referral is quite a list of provider agencies, and quite often with New York State mental health, OASIS, or Opwood funding, they actually tell us who to contract with and don't give us very much leeway. I believe that was at least the historical basis for that language in the specific legislative action.
Okay, then through the chair, could this be amended to basically reflect what you just said, Mr. Franklin, as opposed to broad in the world? Something to the effect of to agencies as mandated by New York State through funding grants or whatever?
Madam Chair, we definitely can work on adjusting this language before the full legislature needs to vote on it.
Perfect. Thank you very much, Mr. Franklin. I yield the floor.
Any further discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0368, authorized professional service contracts for the Monroe County Office of Mental Health Socio-Legal Center.
Move.
Second.
Moved by legislator DeFlorio, seconded by legislator Hasman. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0369, acceptance of a grant from the New York State Office for the Aging for the Coronavirus Preparedness and Response Supplemental Appropriations Act and amend Resolution 186 of 2020 for authorization of contract for Monroe County Office for the Aging programs in 2020 to 2021.
Move it.
Second.
Moved by legislator DeFlorio, seconded by legislator Hebert. Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0370, acceptance of a grant from the New York State Office for the Aging and authorization of contract with Lifespan of Greater Rochester, Inc. for the Lifespan Respite Care Program.
Move it, Madam Chairman.
Second.
Moved by legislator Colby, seconded by legislator DeFlorio. Is there any discussion?
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you to the administration, on the second line of the referral, it makes reference to, and I quote, uppercase NYSOA. Is that a typo meant to read NYSOFA?
Through the chair, that would be, yes, NYSOFA, New York State Office for the Aging.
So that needs to be corrected. Thank you. Through the chair, I believe Monroe County has received this grant in the past. Do we know how this funding compares to the prior year or years?
This year, there's been a significant increase, and this grant was provided through the federal government to the New York State Office for the Aging with additional deliverables that Lifespan of Greater Rochester is expected to deliver. But this is an ongoing grant from the federal government to serve New York State caregivers respite services.
Understood. Thank you. Through the chair, in the third paragraph of the referral, it states that the NYSOFA has directed the county to contract with Lifespan. Can you please explain to me how the county's procurement requirements, especially those related to the MeBe-WeBe requirements, are followed in this type of situation?
This grant was directed to Lifespan of Greater Rochester by the New York State Office for the Aging. So as far as Monroe County in regards to procurement, we did not have a hand in that, and that would be directed towards the New York State Office for the Aging, which I would hazard to say that they would go through all those mechanisms in order to accept this grant from the federal government.
Through the chair, then if we reported our total procurement for the year, would we take this number out of our divisor?
I don't understand the question, through the chair.
The county has specific goals and in fact is discussing a new referral this month related to MeBe-WeBe purchase requirements. If we are being directed to use a non-MeBe-WeBe, I'm asking whether or not, and this is probably not for you, Mr. Newcomb, it's probably for our chief financial officer or someone in finance, would we remove whatever the amount of this bid was from the total amount of money that we had available for MeBe-WeBe?
Madam Chair, this is Robert Franklin again. I believe what the suggestion is to remove this from the denominator so it does not adversely affect our ratio calculation. I think that is an excellent idea. I'd bet $1 if I were a betting man that our policy doesn't actually cover a situation like this, but we are more than happy to handle this on the fly.
Thank you, Mr. Franklin. Through the chair, if the state preempts or supersedes our county requirements in this type of situation, can you explain how this fits with general municipal law requirements that counties undertake procurement for professional services contracts?
This is Laura Smith, Chief Deputy County Attorney. General Municipal Law 103 actually does not cover professional service as an exception to General Municipal Law 103. Instead, it's covered by General Municipal Law 104B, which permits the county to set its own procurement for procurements outside of public works, goods, and services. So as a professional service, it's not subject to General Municipal Law 103.
Thank you. That answered my next question. Last question through the chair. Can you please provide what you just said in a written legal opinion and explanation?
I'm sorry, could you repeat that?
Yeah, what you just explained, would you mind putting that in a written legal opinion and explanation and delivering it to the legislature?
We actually have several policies of procurement that state that exactly, which we'd be happy to provide tomorrow.
Okay, thank you very much. That I yield the floor.
Is there any other discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0371, authorization to contract for Monroe County Office for the Aging programs in 2021 to 2022.
Move it.
Second.
Moved by Legislator DeFlorio, seconded by Legislator Hebert. Is there any discussion?
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you to the administration. The referral states that all vendors were selected through RFP or RFQ unless they were considered sole source. Could you please tell me which vendors are sole source and for which services they were sole source?
Through the Madam Chair, the Alzheimer's Association of Greater Rochester is our only sole source contract.
Thank you. Can you provide us with some written documentation of how and why they were determined to be sole source? Just something simple.
Yes, through the chairwoman, yes, I will do that. I have documents on hand that I will send down to the legislature.
Thank you. I yield the floor.
Is there any further discussion? Seeing none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0372, amend Resolution 109 of 2019 to authorize contracts for the preschool special education program.
Move it, Madam Chairman.
Second.
Moved by legislator Colby, seconded by legislator Udison. Is that who I heard? Is there any discussion? All those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0373, amend Resolution 203 of 2020 to amend, increase, and extend the contract with Reliance Staffing Systems, Inc., DBA Career Start to provide nursing services for the Monroe County Department of Public Health in response to COVID-19.
Legislator Hebert.
Move it.
Second. Sorry.
I didn't catch you with that.
Who was the mover on that?
Wilt, legislator Wilt.
Moved by legislator Wilt, seconded by legislator Hebert.
Legislator Hebert.
Is there any? Legislator Hebert, you have the floor.
Thank you. Is this being funded through you to the administration, Madam Chair? Is this being funded by CARES Act funding?
Madam Chair, we have Kathy Kerlock or Kathy Hill-Tunin available to answer that.
This is Kathy Hill-Tunin from Nursing Services. The last part of your question sort of faded away. Could you repeat, Matt, through the chair?
Happily, through the chair. Is this being funded through CARES Act funding?
This is Kathy Hill-Tunin through the chair. I would need to get back to you on that. There are.
Hi, this is Frank, Madam Chair, with Health Department. It's being funded through 2 different grants in the Health Department, not CARES funding.
Thank you. I yield the floor.
Seeing no other discussion, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0406, acceptance of a grant from the Regents of the University of New Mexico on behalf of UNM Health Sciences Center for participation in the Federal Agency for Healthcare Research and Quality Project Extension for Community Healthcare Outcomes to advance improvements in COVID-19 preparedness, safety, and infection control at Monroe Community Hospital.
Move it.
Second.
Moved by legislator DeFlorio, seconded by legislator Hebert. Is there any discussion? Seeing none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Next item.
Referral 20-0407, acceptance of a grant from the CARES Act Provider Relief Fund, HHS Stimulus COVID Infection Mortality Rate Incentive Program distribution to support safeguarding residents from the perils of coronavirus pandemic at Monroe Community Hospital.
Move it, Madam Chair.
Second.
Moved by legislator Hebert, seconded by legislator Hasman. Is there any discussion?
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you to the administration, can data be provided to the committee detailing the total number of infections and fatalities, and of those, the percentage which had pre-existing conditions for all nursing homes within Monroe County?
Madam Chair, we have Alyssa Tallow from MCH to answer that.
The chair, I believe Legislator Hebert's looking for the county in total. I can provide statistics for MCH related to our resident positivity and deaths. We had 2 resident positives early on in the COVID pandemic. One was sent back to the hospital and I believe was discharged to another nursing home. The other remained with us and actually did recover, and we've had 0 deaths in total.
Thank you. Is it possible to get that information for the rest of the nursing homes in the county?
Through the chair, that would probably be something that we could work with Mike Mendoza's team to find that information out for you.
Madam Chairwoman, that data is actually collected by New York State Department of Health, so we would not have access to the data. Those agencies are licensed and monitored by New York State.
So through the chair, Ms. Crossdale, there's no way to obtain that information from the state?
We can certainly ask. The skilled nursing facilities have been trying to get that data, as have family members throughout the community. DOH has released some information, but we would have no way of knowing for sure if they would be able to correlate and give us that data.
Through the chair, I would ask that you at least give it a good old maybe try.
Through this, Madam Chair, we can certainly ask. We'll try.
Thank you. I yield the floor.
Is there any other discussion? Seeing none, all those in favor, please signify by saying aye.
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 Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the November 24th, 2020 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, December 22nd, 2020 at 6 p.m. I wish each and every one of you a healthy and happy Thanksgiving.